makes so much sense though, right? Like, it makes so much sense. I'm like, when I first started learning about this, I was like, "How did I not know about this? How does everybody not know about this? How is this not on the news?" Like, what? You know?
What are we doing? Yeah,
What are
like,
we
if this is
doing?
that effective, what in the world?
And
Yeah,
it's just
I
because it's new.
welcome to The Cultured Therapist, a podcast for the curious and the bold to come together and discuss topics, interests, and experiences of the mental health care field. I'm your host, R.C. Winters, a licensed professional counselor in the state of Louisiana, and I work in the field in private practice. Each episode, I interview a helper from a specific region of the United States that is providing care for others through this work. And we take the time to get to know them and the topics they feel therapists, clients, and the public at large might benefit from hearing more about. With so many topics to choose from, there is bound to be something here for everyone. Today, I introduce you to licensed professional counselor supervisor and licensed addictions counselor Rebecca Dagereau. Rebecca is a co-owner of the Prolific Counseling and Recovery Guidance Group, which she co-founded with two other counselors in 2021. Rebecca has her degrees from the University of Louisiana at Lafayette with a Bachelor's of Arts in Psychology while minoring in French, and she has her KCREP accredited Master's of Science in Clinical Mental Health Counseling. Starting out in her counseling program at the university, she was enamored with the benefit of experiencing being a group counseling facilitator. She joined Victory Addiction Recovery Center not soon after graduation, becoming a group leader and working on getting her counseling license. During that time, she was able to also receive her licensed addiction credential through the Addictive Disorder Regulatory Authority through the state of Louisiana. After falling in love with addictions work and enjoying that part of her journey, she then began teaching about addictions for multiple semesters to incoming freshmen through the University 100 courses offered at her alma mater. After leaving from working with addictions, she was in private practice for a period of 3 years until she became a co-founder of the aforementioned counseling group practice. Now, Rebecca and I have known each other for years, and I have such an admiration and respect for her to have the privilege and pleasure of working with her in group formats when we were learning together in our master's program is a time which I still and will likely always treasure. She is someone I could go on and on about as far as authenticity, lovingness, brilliance, and so on. But I think I will let the episode speak for itself. In this episode, we discuss her experiences in the role of counselor, both for addictions and as a helper in other concerns, how she views the power of the therapeutic alliance, as well as how she views the present role she has now and for her future expectations. In addition, she discusses being a counselor supervisor and its many benefits to her expression of joy and reflection in her professional roles. Finally, a significant breakthrough of the Stellate Ganglion block protocol is discussed in detail, offering listeners the chance to learn about a scientifically backed process for reducing overwhelming anxious responding through a minor surgical procedure. I was completely unprepared for what it could mean for those suffering with PTSD symptoms, pain, anxiety, and by the end, I think you'll be surprised too at its implications. So buckle up and get ready for an interesting and lively discussion with my good friend and colleague, Rebecca Dagereau. Let's jump in.
I think I've told you before, I wasn't always sure that I wanted to be a counselor. It wasn't something that I knew since I was a little kid or anything like that, that was what I wanted to do. But I always liked people and I was always that friend that sort of had that invisible sign over their head, right? That said, talk to me and tell me your problems. And very quickly fell into that role in most of my friendships growing up and especially as a teenager. And so naturally just went into psychology in college and wasn't sure what I was going to do with it, to be honest, but I thought the material is interesting. I always loved learning about people and why we are the way we are. And so then I went on to get my counseling degree. So.
And that journey that you went on while you were moving into counseling, was there anything that told you that this was the right journey or that directed you towards it as like, yeah, this is the thing?
Oh man, what a good question. It's funny because in grad school, I don't know what other graduate programs are like, but counseling graduate programs specifically are very challenging personally. Academically too, of course, in certain ways, but I would argue much more challenging personally than it is academically in a lot of ways. And so there's certainly times where you're like, God, this is so cool. I love this. This is like geeking out about it, right? And then times where you're like, this is hard. I don't know if I could do this. Like, I don't know if I want to do this anymore. And I certainly had my moments where I doubted, like, do I really want to do this forever? Can I do this forever? Like, is this really for me? But then you have those moments in the room, whether it's in group or with a client, where there's just like this magical thing that happens between two humans that you can't even fully explain with words, at least in my experience. And then you're like, oh, yeah, this is why I do this, you know? And then my best friend told me later on, it's funny that who's known me since 2nd grade, and she's like, "I've never met anyone more meant to do what they do than you." And I was like, "Oh, that is like the sweetest compliment in the world," right? Because she doesn't love her job. She's in, like data analytics and whatever. And so I thought that was really cool.
Yeah, what we do is so very pulled away from the typical experience of profession and everyday life that I run into with my clients and with my friends and family, and we're talking about deep, deep things. Would you say
Absolutely.
a
I
hundred
said
percent?
100%. Yeah. It's different. It's just like it's hard to explain, like to people who aren't clinicians, right? Like they have an idea, but they don't really know, right? Like what the work is like and how intense it can be and heavy it can be, but also rewarding and meaningful it can be, and but I do feel very fortunate to be able to like honestly say that I love what I do. And unfortunately, as I'm sure you know, with most of our clients, that's not the norm.
I forget what they call it. Is it ikigai? That Japanese
Mm.
term for like all things equal. You have purpose and this and that, and it all comes together. Do you know what I'm talking
Yeah.
about?
Yeah, I'm not familiar with the term, but I think I know the concept.
Yeah. There's another thing I'm curious about for you, addictions in
Yes.
general. Tell me more about that process of getting into addictions as a modality, or not, maybe not a modality, but like a way of seeing
Mm.
how you can help and how you can give back to your community, because it sounds like that was really impactful for you.
It was, and it was not part of my plan, nor something I ever would have guessed prior I would have, like, ended up focusing on or had interest in. When I finished graduate school and I was looking for my first big girl job, I, was still looking around, applying places, and I got an opportunity to work at a treatment center. And with addiction space, with like a full scale inpatient addiction center, I was in the outpatient program at first, and I eventually moved into the inpatient side throughout my time there. But the primary modality we use in addiction, especially in treatment specifically, like at the inpatient and the high intensity outpatient level, is group. And that was one of the things that I specialized in graduate school. I took a lot of additional training, as you know, right, with in group. And I loved group work. And I remember in my interview telling, like, being very transparent with them of like, addiction's not something I have a like personal. A lot of people go into the field because they have a lot of personal experience with it, right? Either in their families or with someone they love close to them or themselves. That's very, very common in the addiction space. And that wasn't my experience. I wasn't in recovery myself and didn't grow up with a family member struggling or whatever. And so I told them very honestly, I was like, this isn't really my wheelhouse. Like, I don't know a ton about it, but I can do group. Like, group, I got, right? And she was like, all right, well, you're going to learn. And that's exactly what happened. I was able to apply all of my group knowledge, all of my theoretical knowledge, right? Like all of my clinical skills. And then over time, kind of in the deep end, learning about specifically the addiction space and everything that that encompasses. And while I was there, I ended up there for 4 years. Something just clicked while I was there, and I just ended up loving it. I really loved it. Still do. It's still one of the biggest focuses of my work, even in private practice and kind of the whole addiction family system. And it's something that our practice focuses on a lot and really promotes in the community. It's something that's I think still extremely stigmatized, unfortunately, and nobody wants to talk about it. And it's, like clouded in shame and secrecy. And that's the worst thing for addicts and their families. They need hope and support and to like bring all this darkness like into the light. And so, but I really, I something about it just clicked for me. I understood it, even though I didn't experience it myself. And I remember even my boss telling me once, she goes, for a normie, you really get this. That's what they call, if you're not in recovery, right? They'll call you a normie. She's like,
Yeah.
for a normie, you really get this. I was like, high praise, right? Like, thank you so much. And I really, developed a love for addicts and their families and their loved ones. And it's a really underserved population that feel really ostracized, very lonely. It's a very lonely, isolating experience. And so I feel very passionate about supporting them and educating people about what this really is. It's not just the stereotype of the guy in the trench coat under the bridge, right? Like the vast majority of our clients are everyday normal people that are just like you and me who got caught up in something that, they never meant to.
There's always the question, when someone goes into something that they've never done before, but are pulled into it and kind of learn on as they go. I wonder every time, what were some of the really powerful or impactful things you didn't know before that when you learned while being in that learning space really impacted you and has changed the way either you see the world or you see yourself, or just these big questions that got answered or something that shifted for you when you were learning?
Good question. So it definitely teaches you humility, right? Like, there's a level of humility you have to be able to own that, like, to sit in front of someone and it's vulnerable, right? To, like, sit in front of someone and to really try to offer them something, and at the same time, like, I'm here to help you, and I want to help you, and at the same time own that there's, like, certain pieces of this that I may not understand or that I may not have the expertise on, and, like, have to just own that and not get defensive or feel offended or, feel attacked when they come at you. Addicts are notorious for that, and, like, looking back, I think that was one of the things that was probably most scary for me was feeling like a fraud, feeling inadequate, as far as, like, do I have can I help these people? Do I know what to do? Do I have the right knowledge? Do I have enough, experience and just having to like trust the process and the connection of human to human. And that's what, you asked what might have changed. I think it really helped me to see that while yes, certain levels of expertise and knowledge are necessary and important, and I'm not trying to minimize that at all, but that at least in the work we do, I think at the end of the day, like, we learned this in graduate school, the rapport, right? The alliance is the biggest therapeutic change, the biggest factor of therapeutic change. And I would argue that like addiction work taught me that like confirmed that for me in real time, that like at the end of the day, the connection between human to human, like someone just being there and like holding space for your pain and like not trying to change you or, save you necessarily, but being willing to stay present in it with you while you do walk your own journey through it. Like, that's the most meaningful thing we have to give as clinicians, regardless of our theoretical orientation or our primary modality or, whatever it might be, that I believe that that's one of the most powerful things we have to give as clinicians. And that's what makes us different than like talking to your friend or your a family member. Is there something really special about that?
Yeah, making space for the pain and not pulling away or shying from it or shaming, or even if it's indirect shaming. I think there's a lot of
Right.
indirect shaming in our families and
Absolutely.
friends. They don't mean to, but they
Mhm.
they put it out there because they can't handle it.
And they don't
And
know what else to say, right? And they're so uncomfortable in that space of, like, being just sitting in someone else's pain that they either try to, like, fix it, rescue them, save them, or they, like, try to problem solve or right? Like, and it's well-intentioned, right? Like you said, like, they don't mean to, but I think that's what really separates clinical work or, like, a therapist from talking to a friend is that we are trained and are very intentional about not jumping in to rescue or to fix or save or offer criticism or judgment, like that we're here to really hold this space for you. And I think that's where so much of the work really happens.
yeah, with my background in addictions, the things I learned were Karpman's triangle and the
Mhm.
rescuer, the those parts that come up. The other thing I learned when I was in addictions was the idea that professionals are not required to experience the same pain as the person in front of them. In fact, sometimes it can be a detriment. And I always heard it as, if a doctor is treating a broken arm, does that doctor need to have a broken arm to treat that patient? And the answer is, of course not. The doctor
Right.
doesn't need to know what that's like in order to still provide a healing response. And that used to help me to explain it to clients and say, look, my job is not to be like you. My job is to help you with your individual experience, make sense of it, and try to use it in the world and then become successful in what you want to be successful
Absolutely. And one of the things I would always ask when they would like some of them didn't care, right? If I was an addict, if I was in recovery or not, but some of them really do, and I that's fine. And, when the ones that did and had a big resistance to working with me because I didn't share that experience with them personally, a lot of times I'd ask if there's, the common saying I'd hear is like, "You don't get it. You don't get it." And I would always ask them like, "What is it that you feel like I don't understand?" And then I'd ask them, "Okay, then help me understand." Right? Like, explain it to me. Like, give me and then, like, really just inviting them to give me their experience, to share it so that I could understand, and kind of, like, challenging the resistance a little bit, but more importantly, like, inviting them to open up to me, right? And that often helped pull the defenses down because instead of defending myself, I asked them to, like, share with me, right? Like, to open up to me, like, "Okay, what maybe I don't understand, then explain it to me, then help me, like, help me understand." And then I used to have a buddy that worked with me on the unit who was in recovery, and anytime somebody would come at me really hard in group, he would say something like he used to defend me sometimes, which I always appreciated, and he would say, "So wait, you're telling me she gets through life without using?" He was like, "Oh, cool, she might have something to teach you, bro." Like, kinda thing, and I was always like, "Okay, I'll take that."
Yeah. Yeah, my
That helps
jaw
sometimes
dropped.
too.
What a great reframe of like, okay,
Right?
look, this person doesn't have your experience, but they didn't have to do what you did to do this. So maybe there's something there that they know that maybe could be helpful.
Right, she might have something to offer you that you hadn't considered?
Right.
And so I always appreciated that when he'd stick up for me that way.
That's a good one. That's
Mhm,
a good one. I like that one.
mhm,
And then when you think of this modality and the demographic that you worked with, you said it was sort of like everyday people. It was an
mhm.
everyday people experience, and a lot of people who were experiencing things that are in everyday positions. When you finally decided to move out of the addictions, what was the demographic that you started working with in private practice?
So, I still do a lot of addiction work in private practice. Some of the what I'd call like pre-treatment work, meaning like people who need treatment but either aren't ready yet or haven't fully accepted how severe their problem is. And that can be really challenging, honestly, in the private practice realm because it's hard to down the extent of the problem in an hour once a week or every other week, right? Or whatever. It's just there's just too much room, right, for them to often like skew the what's really going on. It's necessary step, but it's not very effective in really getting a solid idea of what's going on behind the scenes. But what I was doing is working with folks who were freshly out of treatment or who were newly sober or who might have gotten sober without treatment, just in the recovery community in some capacity. And so, like, having that knowledge base of what treatment is and how it works and what it functions like and what are the common issues early on. And then as they integrate back into everyday life, into their world, into the same system they were in before, how helping them navigate that process. I love that client, that like early recovery client. They're really fun to work with and they need a lot of support early on. And then also the family system that they're in, whether that's their family of origin, their new, if they're married, that family system, just whoever is in their close orbit. Often I work with a lot of those folks too because they need a lot of support. Often the whole system has to change typically for addicts to be successful long term in recovery, and so the people in the system often need just as much support as the identified patient. does. So I work with a lot of those too. And then I did a lot of also in private practice here, kind of what we, consider average everyday stuff of, depression, anxiety, relationship issues, self-esteem, kind of your standard stuff.
Do you use a particular therapeutic model?
I like to say I'm not a loyalist to any particular theoretical orientation. I like to pick and choose what I like and then, integrate it in what feels right to me. I will say I'm very emotions focused and very my business partner calls me the relational therapist, meaning that the relationship between me and my client is really important. And I end up having more often than not, I end up having clients that stick with me for a long time, like a long period of time. And I know that can be controversial sometimes for some folks, depending on their belief system around how therapy should work. But I tend to keep my folks for a long time, and we really go deep into, yes, there's specific issues we're addressing, but really that foundational relational work that can happen when the trust is so secure and so solid and they really get to know each other.
I wanted to ask you, what is your response to that controversial understanding of why time limit is important? And what do you say is your rationale for being okay with a longer time limit?
Sure, yeah, absolutely. And I get on the surface the argument that I hear most often, is that it depends on if it's coming from a clinician or a non-clinician, right? So, non-clinician criticism is often more, I think, pessimistic in the sense that they just think we're trying to keep people sick for money purposes or for income or to keep your caseload and that kind of thing. And I think anyone who does this professionally knows that that's not what we're doing, right? Because there's plenty of clients. I don't need to keep people here unnecessarily, and I don't require any kind of commitment and they have to stay for X amount of time, or I don't do any of that. It's very, case to case and based on what feels right and appropriate for the client. But from clinicians, some clinicians have very strong feelings about, if a client's with you for X amount of time, what are you doing? Right? Y'all aren't meeting goals, you're not making progress, you're not, you're not doing something right. Essentially, is kind of, I think, the mentality. And I just disagree with that. Most of my clients that I'm thinking of, a few are off the top of my head that I've had for a long time, right? They came in with a specific issue typically, right? But the work unfolds, right? It evolves. And the longer we're together and the more I get to know them and the more the trust and the relationship develops, the more deep, not only the deeper we go, but the more their life unfolds. And it's what was going on the first 6 months that they might have been in therapy is not what's going on year 3, that they're in therapy, and we get to walk them through all these different chapters and layers and components and relationships, and that trust is so solid that I find when stuff happens later on, you're not starting over, right? Again and again and again with someone who came to therapy for a few months, addressed an issue and got out. And if that's what works for some folks, that's fine. And that's what some clients do that too, and that's fine. But I have some, I call them my lifers, right? That just not only have a problem they want to solve, but they come to really value this space, the space and the experience of this person that they've come to know and trust, but that's still not in their inner world. It's still this separate thing, outside of their friends and family, but that really have come to know them. Really know them in a way that most people, if not almost anyone, does. And that type of trust and being seen and known is so special and meaningful that that's who they want there for them as they walk through life, right? And I had a mentor who used to tell me that behind every piece of work, there's another piece of work. And she would say, that with some clients, we're just peeling the onion kind of almost indefinitely. Do we ever fully know ourselves? Do we ever fully understand who we are? We can't because we're constantly evolving and changing. I'm not the same person I was 5 years ago.
Yeah, it's a moving
And
target, right?
absolutely, and why not bring your most trusted ally along with you? I don't know, that's my opinion, that's my experience, and I find that my clients that want that seem to really value it, right? Because I can't get rid of them. Even when I'm like, like, we don't have to keep doing this. Like, you're doing great, and they're like,
Yeah,
no, I'm not going anywhere, Becca. You can't
yeah,
get rid of me.
yeah. They're like, "This is my self-care
Literally.
thing."
This
Yeah,
is what I do for myself, and I'll own that I
maintenance.
have my own therapist that I've seen for a very long time and across lots of different chapters, and that's what I've always told her, that, like, this is the one thing across the last, I'd argue, decade that I have held on to consistently that's just for me.
Mm,
It's
yeah.
100% just for me, and even if there's not a crisis or a specific issue, like, my time with her always feels meaningful.
Yeah, I think that's another important piece of our job that most folks don't expect is that we seek those self-care spaces and use counseling and use these tools. We're not saying one thing and then doing another. We participate in the act of self-care as much as we can because we are actually, I believe it's in our licensure expectations that that's
Mhm.
one of our jobs is to
Absolutely.
maintain our groundedness, our well-being, because we can't give from that empty well and all those sorts of things we tell our clients. So
Right,
we
right.
we do it too. And
We
they're
need
like
to.
sometimes they're surprised though, because they're
Yeah,
like,
they are.
yeah,
They're like,
I
"Oh,
did."
you have a therapist too?" I'm like, "Yeah." I'm a human too,
Right.
and I think that can be normalizing for a lot of them and validating, that, like, yes, we have some expertise and some things to offer them, but we're also human beings too, and that's important to me is to kind of connect on that human to human level and not always have that screen of, like, I'm the expert and I'm, sort of this robot with all the answers, sitting across from you.
Yeah, and I often treat it like I probably don't have the answers ever because
Right?
I'm not you. I don't live your life. So any advice I will ever give you is from my
Mhm,
worldview, and so therefore probably not very useful. But I do find it's very tempting to want to give
mhm.
advice even after years of being in this position,
It is.
you
It
know?
is. Very hard not to sometimes.
But, rationale brings us back to what's good for the client, what's good for ourselves in the position we're in of professionalism. And so the clinical voice sometimes makes an appearance. I do find a lot of times there's a voice there that is more humanistic,
Mhm. And I
right?
think clients need that,
Mhm.
you know?
Well, so we've talked a bit about what your past has been like. I wanted to ask you about what are your expectations for the future? What sort of things are you getting into?
Whew. Man, good question. So, as you know, I am the co-owner of Counseling and Recovery Guidance. So we have a fairly large group practice here in Lafayette. And we're really love what we're doing. We really feel, we're really proud of our team. We have a, really, really great team.
Beautiful space. Like I
Oh,
went
thank
visit.
you.
Do you remember I went
Yeah,
visit and I was
we're
just like, "Oh my god, this is gorgeous."
we're proud of it. Yeah, we've worked really hard on this space. It's been a slow evolution across many years. My very first private practice office didn't even have a window. It's a little box. So I'm like, I have evolved, and very happy with it. Yeah, we love our space. I mean, I spend more time here than I do at home, honestly. Like if you look at waking hours, like I am in my office more than I am anywhere else. So the space is really important to us and that it just feel inviting and cozy and warm and, comfortable for clients. And then for the kiddos, a very large portion of our practice is play therapy. I don't do play myself, but a very large portion of our practice is play therapy for children and then the family components that are often a result of that. And so we have a whole wing of the office dedicated to play that I'm really proud of and that's really, really well done and that has a ton of, resources and materials, for the play therapists and for the kiddos. And so I think our kiddos are really happy when they're here. They have a good time. And so I think the goal is, to continue to do what we're doing well and, maybe to even continue to grow it even bigger. We've had clinicians that have moved to different states. We have several clinicians that are licensed in multiple states. Maybe we'll so we're building out more of our telehealth practice as we have more clinicians who are licensed in multiple states and kind of growing that piece and seeing where that goes. And I personally am hoping to do more education and trainings and stuff in the future. I really like teaching. I miss teaching at UL and I really enjoy that space. I need the variety of like the clinical work, the teaching work, the supervision work. I'm also a supervisor. I have supervisees. I really enjoy that too. And so I know that for me personally, I need that like mixture of roles and the types of work to keep from getting burnt out.
I was going to ask, so you have your LPCS, which for listeners who maybe are not aware of our system, the LPCS is a supervisor
Mhm.
addition that basically allows you to work with provisionally licensed counselors who are trying to get their license. What are some of the things that you run across as a supervisor that you think you would like to share or think are interesting?
Supervisees are so fun, right? In my experience, for the most part, you know, you have your challenges here or there, but that's predominantly really positive and really fun for me because they're just like really high functioning clients, right? It's kind of the way I see them is they're like really high functioning clients because so much of the supervision work is yes, like of course, case and conceptualization and how to navigate each of their clients in the cases, but as much as it's like teaching them about how to be a counselor, like from a theoretical or intervention space, it's how to navigate your humanness and your role as a clinician. I find that's the bigger piece of work and supervision is like you learned all this stuff in school, you know a lot of this. Now, how do you integrate that and show up in the room as you, specifically individually you, right? And what you believe and think and do as a clinician and like how do you integrate those and like get more confident and more secure in what that looks like. And so much of the and so far my experience I've only been supervising for a couple years now, 2 3 years, but so much of it is really reinforcing and validating their confidence as a clinician, their instincts. Most of them, their instincts are right spot on, right? Like most of the time, they just don't believe in themselves enough, you know, or they don't trust themselves enough yet. And that's normal. That's developmentally normal, right? In the, developmental process of becoming a clinician and growing into a clinician, growing as a clinician. And so it's really fun. It sort of has this like almost maternal big sister feel to it for me that like I feel like that my mama with my baby birds, like I'm mama bird and they're my baby birds. And I'm just like, you
Yeah.
can fly. I'm gonna push you out the nest. You got this. Like I believe in
Yeah.
you. And so it's really fun. And it's really fun to see the different clinicians, right? And their different personalities and their different interests and their different, belief systems and specialties and to get to collaborate. I do group supervision once a month. So we all get together and we collaborate and talk about cases and share information and resources. And, sometimes it's like, what are you reading right now? And like, what do you like? What are you into? And what's a good podcast you listened to recently, and just sharing, we're all dorks about humans, so we sit around and geek out together about how much we love humans.
Wonderful. That's the best way
Yeah.
to feel about this work we do because it can get really heavy, but having those moments where you really value and make it more fun and creative and tap into that inner child feeling of yeah,
Mhm.
that dorkiness. That's a good word for it. It's just like, "Oh, I'm gonna geek out on this and I don't care."
Literally.
Yeah,
And it's
it's a good
fun.
feeling. Yeah.
Yeah. You need that.
So I ask everyone to bring a topic that's really close to their heart, at least if not something they've always been excited about, something maybe they've just learned about or something that's getting them excited. Well, you texted me this information I have never heard of, and I got really into like this intense learner's moment of just being like, I need to know what this is. Like I have no idea about this. So I'm so excited to hear about this, and I'm just gonna let you take it away.
Yeah, cool. I'm so excited to share. Okay. So I say in the last year probably been educated on and have come to be a firm, full-fledged supporter and believer in what they call the Stella ganglion block, which is a medical procedure that they're using to help treat PTSD and anxiety. And I'll explain to you what it is, but to the best of my ability. Disclaimer, I'm not a physician. But right, what it is. So we have a bundle of nerves called the stellate ganglion in our neck, right? We have one on each side. And I'm oversimplifying this. This is a very complex, like nervous system, but I'm going to water it down for our purposes, right? But we have these so our the pathway between our brain and our body essentially, right, is our nervous system, and that's what transmits the messages back and forth between like what we're thinking and feeling and into the way our physical body responds, right? And so we have this bundle of nerves on each side of our neck called the stellate ganglion. And what they've come to realize is that but they've actually been doing this procedure, I think it's for like 100 years or something like that, but it was only ever used for pain. It was a pain management procedure that they were using. And then in the last, like, I think 20-ish, 30 years, something like that, they've come to recognize that people who were getting this procedure for pain specifically were also experiencing benefits in a psychological way. They were experiencing less anxiety, they were experiencing better sleep. They were experiencing lower levels of hypervigilance, things like that. And they were like, wait, what's happening here? Right? It was like a correlation that they hadn't put together. And so they started studying it and then using it specifically to treat PTSD and anxiety. And the results are like out of control, amazing, like they never expected. So what happens is it sounds kind of crazy, but follow follow with me, right? They inject an anesthetic in the neck. So that's what scares most people off. You're like, "You're gonna put a needle in my neck." And I'm like, "Yes, that's what they're gonna do. They're gonna put a needle in your neck," right? But what they do is they inject an anesthetic. So think of like what they give you at the dentist to numb your gums before they're gonna do that, like a much more, significant dose of that, which what it does is it basically puts the nerve to sleep. I wrote it down so that I wouldn't say it wrong for you. There's something called the cervical sympathetic trunk, which is the nerve that is essentially connects the amygdala and the midbrain, our alarm system of our brain, right? Threat is here, react, to all of our like organs and central nervous system physiological responses, your heart rate, your lungs, your muscles, your sweat glands, your all of this. So the example a lot of the doctors will use is like if somebody cuts you off in traffic and slams on their brakes, right? You will immediately respond. Your brain will automatically, your fire alarm goes off. This happens instantaneously. We don't pick this, right? Your fire alarm will automatically go off. It says danger, threat, and you will react, right? And not only do you slam on your brakes, but your heart rate increased, your lungs expanded and filled with air. You might have started to sweat already. The hairs on your arms will stand up, right? Like all of your sympathetic nervous system physiological responses will like go into fight or flight mode. That's what they're supposed to do. That's what we're wired to do, right? And in a healthy system, what happens is once the threat is over and we're like, we're okay. We didn't wreck. Everything's okay. The car is gone. Everything's fine. We go back to baseline, right? People that experience severe traumatic events or chronic stressors or things like that, their feedback loop between their fire alarm system and that central nervous system sometimes can get stuck in that state of threat, right? And that's what we see in PTSD and in people with high levels of anxiety or chronic anxiety or had chronic experiences of trauma or any experiences of trauma, really. And he was saying that they don't know exactly why this happens to some people and not others who can have the same experience, right? And some people end up with PTSD and some people don't. We don't know why that happens. We can't like scientifically explain why this happens for some folks and for some it doesn't, but it does. Right? We know that it does. And what happens is when they do this injection, that's the cervical sympathetic trunk, which is hardwired between our brain and our body, is the highway between of our nervous system. This is basically like think of it as the toll booth of the highway. We're putting it to sleep. So the anesthetic puts it to sleep. It lasts about 8 hours. And what it does is it interrupts the feedback loop that has gotten stuck of you're in threat. You're in a constant state of threat. It interrupts that feedback loop just enough to reset it back to baseline. So it's not that they're like not gonna have a response when they need to. Some people are like, is this gonna turn me into a zombie? Am I not gonna react when I need to? Am I gonna have a lowered, reactionary response? That's not what they're seeing. It just interrupts that stuck loop enough for it to reset back to its normal baseline, what it should be in the average healthy functioning human, right? And then, so what happens is we see a significant decrease in the physiological symptoms of PTSD and generalized anxiety, the hypervigilance, the high blood pressure, the difficulty sleeping, right? Like the chronic paranoia, the nightmares, the things that we see, the physiological symptoms that people experience. It's significant, actually more than it's some of the recent studies I was listening to were saying over 50% decrease in some of those physical symptoms, which is far more than you'll see with any medication. If you read the research with almost 0 to no side effects. And so far, the research they've done, there's, like, almost no negative side effects. There may be a few, like, they make sure when you're done because it's an anesthetic in your neck, when you sit up, like, they make sure that you can swallow and they have you talk. You're monitored for, like, an hour or 2 after the procedure just to make sure, like, everything's all good, whatever. But it's an outpatient procedure. It's done, in a doctor's office, and you can do just one side, but they're realizing the last couple years it's even more effective if you do both sides. So they'll do an injection on one side. It's actually 2 injections. I think it's C4 and C7 on one side, and then they'll have you come back the next day and do the other side. And the difference is for a lot of clients, they say it's immediate. Like, within 24 hours, they can feel a, like, noticeable difference. I've had 3 clients have this done in the last 6 months, and every single one of them have said it's been life-changing, like, absolutely life-changing. It's incredible.
Now, when we talk about the mind body connection, we often talk about the fact that emotions are stored in the body.
Yeah.
And what I'm wondering is like, how does I mean, I don't know if you have an understanding of this yet. Maybe you do, but
Yeah.
how does this affect that body memory portion of this? Because it sounds like it helps that in some way, but do we know how?
I'm not positive. I can tell you what I've seen and what I've heard, right? What I know is that they call it so Dr. Eugene Lipov is kind of the doctor who's pioneering this work. He's got an excellent book called The Invisible Machine. I'll send you the link if you want to attach it in the notes. I read it probably about 6 months ago and just like geeked out. I'm a brain dork, so I'm like, this is so fascinating. And he's got a whole chapter on the everyday person, right? So on, like, yes, people with severe PTSD, yada yada yada. We have our combat veterans, our soldiers, our first responders, law enforcement, that people like automatically are like, of course, a lot of these folks are going to benefit. But he has a whole chapter on the everyday person, who can also benefit from the procedure. I actually do plan to get it myself. I'm planning to go have it done. But sorry, your question. So, from what I can tell and what people are telling me, it does have some immediate effects. Like, one of my clients told me that who had it done, when she had the first injection, she immediately felt like this, like, giant rushing cooling sensation down her left hip. And then when she had the other side done, she felt this, like, big change in, like, her muscles, like, in her back, right? So she could physically feel how, like, her body was releasing, like, certain things was already starting to release. But what I think the real ticket here is that this isn't meant to be a magic pill, right? Like, this is meant to allow people to do the work that often they haven't been able to do or haven't had the space and access to do because they were in so much of a state of chronic stress and anxiety or trauma, right? So they call it the primer to the paint, right? Meaning, like, if you get this done, a lot of times then they can engage in the therapy that they wouldn't touch before, right? Then they might be willing to actually do some of the somatic work when before they wouldn't have let another human touch them with a 10-foot pole, right? Then they might be willing to do certain other pieces of therapy or different, coping skills that just weren't even accessible before because they were so keyed up, right? Because their system was so on fire that, like, it just wasn't either available or they didn't have enough coping regulation to even manage what was happening when they were trying to do that work. And this calms the system down so significantly that then they can go do the work they've been needing and wanting to do that they just couldn't.
Wow.
That
That
makes sense?
sounds Yeah, but that sounds it almost sounds otherworldly. Like there's not a lot of stuff that does that for folks.
Right. It's incredible. It's, like, unbelievable. In fact, and so for the people who are worried that, like, maybe this'll Like, will this make me some kind of like zombie? Will this like term it doesn't change you at all. We're just like resetting your nervous system a little bit. And apparently in the military community, they actually in some of the like really high level ranking like elite squads of folks, I'm not going to use the right terminology, right, but that are doing the really, really covert, dangerous stuff, they actually require it between deployments because they've shown that it improves their reaction time because they're not bringing gunk from the last mission to the next one. Does that make
Wow,
sense? Isn't
it
that
does.
cool? Yeah.
That's wild.
I'm
I've
like, "Oh
never
my
heard that.
god, it's so cool." This makes so much sense though, right? Like, it makes so much sense. I'm like, when I first started learning about this, I was like, "How did I not know about this? How does everybody not know about this? How is this not on the news?" Like, what? You know?
What are we doing? Yeah,
What are
like,
we
if this is
doing?
that effective, what in the world?
And
Yeah,
it's just
I
because it's new.
that's it. Yeah, well, then this is really exciting because you're putting this out there, and hopefully some of our listeners who might have felt a little uncomfortable or heard about it will
Mhm.
will have the opportunity now to feel a little more comfortable or excited about the possibility of finding that foundational reset.
Yes, so cool.
I know. Like, I had to ask about the dissociative
Mhm.
aspects because I don't know if there's been a lot done with the dissociative disorder side of things. And not even for the disorders, but just like folks who have the dissociation, does it tend to help with that from what you've seen?
So I asked Dr. Springer, who's one of the clinical psychologist who's like in charge. So she's not the MD, she's the psychologist who is kind of like the spearhead of what's going on with SGB in the country about it. And she said there's very few populations who are like counterindicated for the procedure. And she said the main ones are like really, really, really severe personality disorder clients tend to not respond well or it's just not targeting, like there's too much other components woven into what's going on for them, internally. So they see that they don't see a good result or that they don't seem to be good candidates for the procedure. And then there's certain medical conditions that can, eliminate it for whatever reason, that can say like this isn't safe to do for these reasons or not. But that otherwise they're seeing that because the nervous system resets significantly. I don't know if they have the research yet to prove this, but what hearing from her and what I've read, it seems that like the level of dissociation is going down because they're feeling safer and they don't have to dissociate as much.
Okay. That's important because I have a lot of clients that we do like things like internal family systems or we
Right.
do something to try to help the dissociation, but it takes
Forever.
a time. And so if there was something that could speed up that process for them, that's always good to hear.
Incredible.
Yeah, that's cool. So anything else that you want to add about it that you felt has not been covered? Because I'll sit here and listen to this all day. This is wild.
That's so cool. So one of the biggest things they'll see is sleep, right? I had a client, the one who talked about her hip. She has a significant trauma history and suffered from chronic nightmares. And so she's in her mid 30s and probably for her entire adult life has never gotten a full night's sleep, with medication, like that's how her system was wired. And after she had the procedure done, the first night that after her first injection, she said she slept 7 hours unbroken, which is the most sleep she's ever had in her adult life. Like she said, I haven't done that since I was a kid, like easily. And then since then has consistently had almost, I think, maybe one or two occurrences of a nightmare but almost no nightmares and has consistently been sleeping well since she had the procedure done. Like that alone, she was like, not only is her like overall, like her hypervigilance and everything has significantly reduced, but she was like, the sleep alone was worth it. Like I would have done this 10 times over just to get the sleep. Right, that I can get now because it was so significant. Like it's been so significantly improved for her. When you get the injection, there's 2 ways they can do it. So they can put you some people are, like, understandably squirrely about being on a table and having someone stick a needle in their neck, right? So they will do that, like, twilight sedation. So they'll essentially put them to sleep. It's not full-blown, anesthesia like you're getting surgery, but it is twilight sedation. So they are asleep. You won't remember it, you won't feel it, they are completely, asleep for the procedures. They can do it that way. or you can opt to be awake and just get a general local numbing medication. And so I've had clients do it both ways, and it's just a preference as far as if they, like, wanna be awake and prefer that, like, feeling of, like, knowing what's going on versus the ones who are like, "I don't want any part of this, put me to sleep," you know? And they're like, "I wanna wake up and I'm better," right? And so but they can do it either way, and for some people, especially, the ones who are already, like, their nervous system is so on drive, there's no way that their nervous system would even allow someone to get close to their neck with a needle, right? And so those are the ones that the doctor will strongly recommend the sedation, right? So that they can do what they need to do and they're not going to move or jump or freak out or, spike a, heart rate in the last minute and that kind of thing. Yeah.
Yeah, so it's
It's
like
not expensive, honestly, in the
that was
grand
my
scheme of
next
things.
question. Yeah,
Yeah.
I was gonna ask about, like, insurance or, like, how does it work?
So, unfortunately, no insurance coverage, but Dr. Springer said that they're hoping, and with the research that they're doing and publishing, they're hoping in the next 3 to 5 years to start being able to get insurance coverage for it. But right now, it's all cash pay, but there's lots of programs out there that will help cover it. In fact, we have a local organization, the AVA, the Acadiana Veterans Alliance. If you're a veteran of any kind, any branch, at any time, for anything, you can be active as well. You don't have to be retired or, out of the service. They will cover like 80% of the procedure financially and help connect you with a doctor. And there's different places. They have satellite offices. All the like main headquarters is in Chicago, but they have satellite locations all over the country with like Stella. That's the name of the institute. Is the Stella Institute. They've trained specific doctors. They have a specific protocol. Dr. Lipoff himself has trained them, and like all that kind of thing. So to make sure that the quality of care is there, they have Stella Institutes in multiple places around the country to help eliminate travel costs for folks. But you're looking at roughly $1,000 to $1,200 a side. So if you did both sides, maybe around, call it three max, 3,000 total for both sides. That's for the procedure. That wouldn't include like if you needed a hotel and travel costs, right? And things like that. And it's supposed to be relatively a one-time thing. So you can do it multiple times. There's no like medical negative outcome for having it done more than once, but it doesn't need to be done multiple times. So they say that the effects of the injection should last roughly 12 to 18 months. And the majority of clients are seeing that in those 12 to 18 months, they're able to do the work that they need to do if they're especially if they're engaged in psychotherapy and in other therapies and doing taking care of themselves, that they're usually able to improve their coping skills and their normal mental health during that time frame, that they often don't need any follow-up injections. But some people will get an additional injection a couple years later or even multiple years later, and there's no negative medical side effect to that. It's almost, think of it like a booster shot, like it's just like either something else happened that was really severe, or especially with our clients that like are live in a perpetual state. Think of again of your first responders, your active duty military, your law enforcement officers who are just their baseline is already really high, and we're not sending them back to a calm, loving environment. Like we're sending them back to a very high pressure, high stress, potentially traumatic environment. It doesn't tend to work as long for those folks, understandably, right? Because their system's being reactivated on a very regular basis. So they might need more injections along down the road than, say, your average everyday person. Not necessarily, but that's what they're seeing just kind of with the data. And that makes sense, right? But there's no like, you're not going to like develop a tolerance to it. There's no like, it doesn't deteriorate your system in any capacity. Like, there doesn't seem to be any like medical repercussions. It just might not last as long if you're in a very like triggering environment on a regular basis.
Are there any longitudinal studies about the stellate ganglion block?
So, because they've only been using it specifically for PTSD for about, I think, the last like 15-ish, 20 years, that's the most research they have targeting that specifically. But the procedure has been around for over 100 years and has been used safely for pain for over 100 years. And from what I understand, any of the research I mean, it's targeting pain, but there's been no research to show that it had any long-term side effects on the body for the patients that were getting it for pain. So, theoretically, there shouldn't be any that we know of.
What about digestive health and, the second brain
Mm.
theory that we have where like this bacterial microcosm that's there is this really important piece of it. I'm wondering how does that affect
Mm.
some of these major systems as far as you've seen for your clients or maybe you've heard anything?
I haven't gotten any feedback specifically around that. That's a very good question. I'd be curious to ask Dr. Lipoff what he sees about that and Dr. Springer what they've seen. I do know that one of my clients that had it done, this isn't digestion related, but she was able to quit nicotine for the first time in 20 years. She'd been trying to get off nicotine for 20 years.
Wow.
And she was able to quit nicotine. And I'm convinced I told Jess, my business partner, right, I was like, "You will not convince me that this would not help addicts," right? Like, obviously, my passion for addiction, right? That's, like, one of my main areas of focus. The amygdala, which is the fire like, it's the same part of the brain that's hijacked in addiction, right? Look, there's nuanced I'm not trying to oversimplify it, like, there's nuanced components, of course, with addiction that aren't necessarily PTSD related, but the correlation between trauma and addiction we know is, through the roof. But even regardless, from a neurobiology standpoint, like it's the same system, it's the same highway, right? That we're targeting when we're trying to help people recover from compulsive use. And so I'm just like, you will not convince me like that this would not help addicts. Like, imagine what outcomes might look like if addicts got this treatment before they left, like if they got the SGB shot before they left treatment. Like,
Like early in the treatment almost.
yes!
Yeah.
Yes! Like, imagine like, I can't imagine how much that could help, like, certain people with
Yeah.
cravings and impulse control and just not being so triggered and keyed up all the time, that, like, how much more success they might see in their recovery by having the nervous system be in a better space. I'm
Wow.
convinced.
Yeah,
I'm convinced.
this is big. It's a big thing, and I can see why this was the topic you chose. It was enlightening. Like, I feel like
So
I don't
cool.
wanna use the word yeah, I don't wanna use the word convert or anything, but I'm like, "What?" I wanna, like, look into this, and then if I find that, I trust you, first of all. Like, everyone out there, just listen. If anyone should be trusted, it's this lady that's in front of me right now.
Aw, thank
Like
you, Ryan. That is so
like
kind. I appreciate that. What a high compliment. Thank you.
Yeah, and I think that this is something that, like you said, it's such a big thing that putting it out there, hopefully someone hears this and feels more open to it if they were concerned or having issues and feels maybe comforted by these words that you're giving, which is like, look, this is like not dangerous. This is something
Right.
that's very doable.
Very doable. At worst case scenario, it seems like it wouldn't work, right? But it like doesn't seem that there's any negative, like there's no potential negative outcomes. And the best case scenario, game changing, right? Like literally life changing exact quote is what, my client, all three of the clients that I've had it done. And my business partner, Jess, she's very open about the fact that she had it done earlier this year and has had a great response to it. Again, improved sleep, lowered anxiety, lowered hypervigilance, things like that. And it's just, I mean, like I said, we need to be screaming this from the rooftops.
Yeah. Well, my friend, I think we're going to end it there, but I wanted to thank you so much for all of your candor and knowledge and expertise and for sharing your journey and just all of the things that you do for the community, which you have been doing for a long time. And it's just such a privilege to come back to somebody that I hold such high regard
Mhm.
and high respect for and see you just blossom and bloom into this fantastic helper and lover of what you do. And everyone that gets to know you gets to benefit from that. So I wanted to share that thought with you. And I appreciate that
Oh,
you came on today and did this because
thank
I
you.
know we're all busy people, but you made time. So I really appreciate it.
Oh, you're so welcome. Thank you for having me. I feel really honored that you asked, and I love connecting with you and just excited to see what you do.
I also want to just offer anyone else out there, if they want to get in touch with you, what's the best way to do that?
Best way to do that is probably on our website. So our website is www.counrec.com. So counrec.com. Of course, we're all over social media as well for counseling and recovery guidance. And there's lots of different ways you can contact us.
Fantastic. Well, once again, thank you. And I wish you all the best in all your journey because it sounds like you got some exciting things coming up. The Culture Therapist is created, voiced, and edited by R.C. Winters, a licensed professional counselor in the state of Louisiana. It is meant as a tool both in an educational as well as advertising capacity for therapists and those in the mental health field to let future clients, current clients, others in the field, and the general public onto their experiences and interests. If you would like to have a conversation with me such as this, where you clue in others as to what you're all about, you can reach me via email at theculturedtherapistpodcast@gmail.com. And as always, if you have questions or comments, that's a great way to reach me as well. If you thought today's topic, the interviewee, or our format is worth recognition, please follow our podcast, leave a like or a review, or please share it with any family, friend, colleague, or otherwise that you feel might get something out of this podcast. Your help in those ways is most appreciated. Until next time, may you continue to grow, may you continue to thrive, and may you continue to aspire. From The Cultured Therapist, I am R.C. Winters. Catch you next time.